So welcome to ADC webinars 2022, webinar number 6, Clinical Laser Dentistry, to be presented by today's guest speaker, Dr. Vijay Mehetre. He is graduated from Naya Dental College and he has completed his BS in Periodontics and Oral Implantology. He is an assistant professor in ACPM Dental College. He has presented at national and international levels. He is a speaker and trainer for periodontics, oral implantology, and laser dentistry. He is a private practitioner at Aurangabad. He has his own private practice in Aurangabad, and he serves to other private practitioners also. So let's welcome for today's webinar for clinical dentistry. Welcome, sir. Please go ahead.
Thank you, sir. Thank you for such a nice introduction. So let's start with the session.
Yeah.
So am I audible, sir?
Yes, perfect.
Am I audible, sir? Yeah.
Yes.
Okay. Yeah. So good afternoon, everyone. This is Dr. Vijay Mehetre from Aurangabad. I welcome you from I welcome you all from the historical city of Aurangabad. So let's start with the session. So today I am going to share my knowledge about clinical laser dentistry. So let's start with the session. The science of today is the technology of tomorrow, and it is not that we use technology, we live technology. And there are many advances in dentistry which made our work easier. Initially we were using hand files, and now we use rotary instruments, so the time is saved and less effort we need to take for the root canal treatment. Then we have RBG. Initially we supposed to use those films, IOP films, but nowadays we are using RBG. So it is very easy to operate. You'll get a good digital image. Then we have intraoral camera. With intraoral camera, we can have accurate visualization of the oral cavity. Then we have apex locator. So basically technology made our work easier. Okay. Then when we have intraoral scanner and endodontic microscope. Then in surgicals, we have advances in surgery, that is electrocautery. So the latest technology which is used in dentistry is laser dentistry. It is different, better, and it is not a rocket science. Okay. So what is a laser? What comes in your mind when you think of laser? The Star Wars? Yeah. And my past interaction with laser was only limited to Superman. And आजकल ये शादियों में काफी देखा जाता है laser shows and all. So
oh, there it is. Oh.
We all have done these things in our childhood, right? So let's see what is a laser. Laser is a light amplification by stimulated emission of radiation. I'll tell you my journey of laser dentistry. When I supposed to go to the clinics for the consultation, it was a routine phenectomy case. So I went for a consultation, and it was an orthodontic phenectomy actually. So I administered the LA and I started the incision. And the moment there was a slight amount of blood, the patient's relative, which was sitting in front of the chair, fell down. So ultimately that relative got stabilized in 2 minutes, but it was a major trauma for me. On that day I started thinking that I should have some better option So I can able to perform the bloodless surgery, painless, and less anesthesia should be needed. So from that day, I started practicing laser dentistry, and after that, I found these are the advantages of laser dentistry over other methods. There is a reduced need of anesthesia, greater comfort during and after surgery, hemostasis and reduced risk of bloodborne pathogen is there. Then high patient acceptance for the treatment, then reduced stress and fatigue for the practitioner as well as for the staff. Then it is a leading edge technology for perceive of higher level of patient care. It produces less collateral and thermal damage than the electrocautery. Then it overall improves your clinic image. And nowadays patient are Google and YouTuber patient. They search everything on Google and then they will come to your clinic, right? So laser overall improves your clinic image. Okay, these are the advantages of lasers. When used efficaciously and ethically, laser are exceptional modality of treatment for many clinical conditions that dentists treat on daily basis. And nowadays, today, patients are well aware of laser and their advantages. You know what? The people who wear spec know about the ophthalmic lasers, that is LASIK laser, right? In the same way, if that patient came to your clinic, then even they will ask you for the lasers and all, right? So in such cases, you should have an option of lasers in your clinic. Okay. So let's see the classification of lasers. The dental lasers are classified into surgical lasers and non-surgical lasers. Now, surgical lasers are classified into hard tissue lasers and soft tissue lasers. Now, hard tissue lasers have ER laser, ER-YSGG lasers, and CO2 lasers. Soft tissue lasers are diode lasers, NdR lasers, and CO2 lasers. Non-surgical lasers, we have diagnostic lasers, low-level laser therapy, and miscellaneous. So now let's see the difference between hard tissue lasers and soft tissue lasers. Hard tissue laser work on hard tissue as well as soft tissue, where soft tissue lasers works only on soft tissue. Now hard tissue laser work on soft tissue and hard tissue both, so it is called as all tissue lasers. The cutting efficiency of hard tissue lasers is more as compared to soft tissue laser. The cutting operational mode, the hard tissue laser can be used in non-contact mode and soft tissue laser can be used in contact mode. Now, low-level laser therapy can be performed with soft tissue lasers only. You cannot perform a low-level laser therapy with the hard tissue lasers. Now, healing will be faster in hard tissue laser as compared to soft tissue lasers. The cost of machine hard tissue lasers are very expensive as compared to soft tissue lasers. It costs maybe around more than 20 lakh rupees or something. So hard tissue lasers are very expensive. Soft tissue laser, they start from 1.5 lakh onwards. So soft tissue laser is cheaper as compared to hard tissue lasers. Now let's see the difference between laser, scalpel and electrocautery. Anesthesia is compulsory for scalpel and electrocautery. You may or may not need anesthesia for lasers. There will be minimal bleeding with the help of laser as compared to other two. Suturing will not required with the help of lasers. Healing time for laser, it is faster as compared to other two. The patient comfort level, lasers are very comfortable. The tip flexibility is there with lasers. With scalpel, you can't see, you can't bend the blade, right? So with lasers, we have a tip flexibility. Then lasers have self-sterilizing effect. You need to autoclave the blade or you can discard the blade, but the laser have self-sterilizing tips. Okay. So hemostasis can be achieved more properly with the help of laser as compared to the scalpel method. Scar formation will be minimal in lasers as compared to other methods. Now let's see the zone of necrosis or depth of tissue damage around the cut. If you're we have a option of performing the surgery in three ways. One is conventional method, that is scalpel blade, another is electrocautery, and third one is lasers. Now let's see the depth of tissue damage around a cut. For scalpel it is 100 to 320 cell layers. With electrocautery it is maximum, it is around 1200 to 1400 cell layers. With lasers, with diode laser 20 to 25 cells only, and with erbium lasers 5 to 10 cells only. So depth of tissue damage is less with lasers, and this is why healing is faster with the help of lasers. Okay, so let's see what all safety precautions you have to take when you are using lasers. First thing, these are specific wavelength specific eye protector which you should use when you are using lasers. Now see, there are different goggles: blue, red, yellow and green, right? These are not different colors, these are wavelength specific goggles. For example, if you are using a soft tissue laser, you cannot use a laser goggle which can be used for hard tissue. You have to use the same wavelength laser for a same wavelength. Okay. So another thing, if you don't have the goggles, then you can mask the eyes of the patient with a wet gauze, and you can cover the eyes of the patient with normal goggle. Okay. Next thing, you should use high volume suction to eliminate the plume as well as scattered radiations. Now, when you are operating with lasers, you should use non-reflective surface instrument for the procedure. Now, if you see the animation, you can see the laser which is imitated by Iron Man falling onto the shield of Captain America and reflecting there and killing the adjacent enemies, right? In the same way, laser can be reflected and can damage the adjacent mucosa. So make sure whenever you are using lasers, you should use non-reflective surface instruments. Okay. Now, these are the specific laser safety foot control which you should use when you are using laser. Even if accidentally you press the foot control, it will not emit the lasers. These are the laser safety stickers which you should paste outside your operatory. So during the operation, no one should enter into the operatory. Now let's see the laser uses in dentistry. In periodontics, it can be used for initial pocket therapy, non-osseous gingival surgery, phenectomy, gingectomy, gingivoplasty, biopsy, periodontal regeneration surgeries, depigmentation, and removal of granulomatous tissue. Now, osseous recontouring can be done with the help of laser, but for that you need to have a hard tissue laser. In implantology, it can be used for second stage surgery, periimplantitis. Then in prosthodontics, it can be used for crown lengthening procedure, then osseous crown lengthening, roughening, formation of ovoid pontic, altered passive eruption management, modification of soft tissue around laminate. Then in removal prosthodontics, it can be used for EPLAs, denture stomatitis, residual ridge modification, tuberosity reduction, torus reduction, and soft tissue modifications. In pediatric dentistry, it can be used for exposure of teeth and soft tissue management around the orthodontic brackets. In oral surgical procedures, it can be used for biopsy, operectomy, apicectomy, and treating oral soft tissue pathologies. In operative dentistry, it can be used for detection of caries, removal of decay painlessly, for removal of defective composite, GIC restoration, and for the bleaching of teeth. Now, root canal disinfection can be done with the help of laser. The people who claim that they do root canal with the help of laser is a bad publicity, I can say. Root canal disinfection can be done. Like first you have to complete the BMP, and then after that you can disinfect the canal with the help of lasers. Okay. Now chase your passion and money will come, and chase money and you may never find your passion. Okay. So let's see few surgical cases and let's discuss few cases where I have used laser to treat the periodontal conditions. Now, before that, let's see the difference between gingectomy and gingivoplasty. Gingectomy is the excisional removal of the gingival tissue for pocket reduction and elimination, and gingivoplasty is the selective reshaping of the gingiva to attain more physiologic contour. Let's see a case. I think I'll skip these theoretical slides, rational and indication for the gingectomy procedure. Let's see a case of gingectomy. This patient approached us, referred to us by an orthodontist for the gingectomy. If you can see, the gingiva is grown up to the incisor level. Even I can say beyond the incisor level. So we have performed the gingectomy for this case. This is a pre-operative photograph and this is a post-operative photograph where we can see a good gingival contour is maintained properly. Okay, so here is slight amount of recession which will be covered after the orthodontic treatment. Let's see a case of canine exposure for the orthodontic treatment. So this is a pre-operative photograph where we can see the canine is impacted. In CBCT, we can assess that there is a slight bony window onto the canine. So we have done a canine exposure with the help of lasers. Let's see a video of this case. So this is a pre-operative photograph on the left. Then we have exposed the canine. Immediate bracket placement can be done as there is no bleeding or zero bleeding we can say. And this is a post-operative photograph, immediate post-operative photograph with the activation. Okay. So you don't need to wait for the healing and all. You can immediately place the bracket and you can proceed with the traction. Okay. So let's see a case of crown exposure in pediatric patient. So this is a pre-operative photograph where we have waited for 6 months for the tooth to erupt, but it didn't erupted because of dense fibrous tissue onto the incisal surface. So we went for a crown exposure with the help of lasers. Now, while performing those cases, make sure you should open only incisal surface. Don't remove this whole attached gingiva. So make sure that you should open only incisal surface. Let's see a case of crown lengthening. Crown lengthening is a routine procedure which we perform on day-to-day basis. So this is a pre-operative photograph and this is an immediate post-operative photograph. With the help of lasers, there is minimal bleeding and you can go for a crown preparation immediately. Okay, let's see a video for this case. Okay. Let's see another case of crown lengthening procedure where we have performed the crown lengthening for the anesthetic crowns. You can see anesthetic crowns pre-operatively. So we have performed crown lengthening over here, and we can see a beautiful temporary crowns after this. Note one thing, that we have maintained the gingival zenith in this case. Okay. So let's see case of operculectomy. Now there is lot of confusion between practitioners whether to retain the tooth or whether to extract the tooth, or we can say whether to go for operculectomy or whether to go for disinfection procedure. Now the decision will be depend upon three factors. First factor, if you are going for operculectomy, the tooth should be in occlusion of 7 level. Okay. Second factor, the tooth should be vertical. It should not be mesially, distally, buccally, lingually tilted. It should be vertical. Third important factor, that that there should be a slight amount of attached gingiva present buccal to 8. If you are meeting all these three criteria, then you can go for operculectomy. But if any one of these three criterias are missing, then you have to go for extraction or disinfection procedure. Let's see a case of operculectomy. This is a pre-operative photograph showing 3/8 partially covered with the gingiva. So in this case, we have performed the operculectomy. This is a pre-operative photograph. This is an immediate post-operative photograph, and we can see a beautifully exposed crown is there. Okay, and this is a post-follow photograph where we can see a beautiful healing. 3/8 is properly erupted in post-operative photograph. Okay, let's see a video for this case. So this is a pre-operative and post-operative photograph of the same. Now let's see a interesting case of failures. Everybody talks about success. No one talks about failure. Here I am sharing a case of failure in operculectomy. So in this case, you can see 3/8 is fully covered with gingiva, right? And even buccal fat tissue is also impinging on third molar area. So we have performed the operculectomy, but after exposing the crown, can you see the crown is lingually tilted? There is no attached gingiva present buccal to 8. And third thing, it is not in occlusal level of 7, right? So all these three criteria are missing. So in these cases, ultimately you have to face the reoccurrence. This patient was none other than myself. It all started from here and ended up over here. So ultimately we went for an extraction. Okay. So make sure if you are going for operculectomy, then you should fulfill those three criterias. Okay. Let's see phenum associated problems. Let's see the difference between the phenectomy and phenectomy. Phenectomy and phenectomy. Phenectomy is relocating the frenal attachment to create a zone of attached gingiva between gingival margin and frenum. Phenectomy is the excising the frenum, including its attachment to the bone. Now let's see a case of conventional phenectomy. This is a pre-operative photograph showing high frenal attachment. We have performed the conventional phenectomy, and this is a post-operative photograph. Now, is it possible to perform this procedure without any assistant? No, it is not possible, because your assistant has to hold your lips, hold the lips, and then you need to suture it, right? But it is not practically possible that everywhere you will have an assistant with you. So in such cases, laser will be a good option, and ultimately with lasers we can do the same procedure without any sutures. Okay, so this is a case of laser phenectomy where we have performed phenectomy procedure with the help of lasers. This is a pre-operative photograph, and you can see in post-operative photograph you can see a beautiful healing over here. This recession was covered with the connective tissue graft later on. Now let's see a case of lingual phenectomy where we have to suture on the floor of the tongue. But it is very difficult in case of pedo patients to give suture on the ventral surface of tongue. This is a case of an adult patient only. We have performed lingual phenectomy, and we can see a beautiful protrusion of tongue post-operatively. Let's see a video for this case. This was an adult patient, so she cooperated well for the procedure. But do you think in pedo patient it is possible? They'll not allow you to suture on their ventral surface of tongue. But in such cases, laser will be a good option to perform those procedures. Let's see a case of tongue tie in pediatric patient. You can see a proper bifidness of the tongue tip in this patient preoperatively, and this is an immediate post-operative photograph where we can see a proper protrusion of the tongue, and now the patient is able to touch the tongue to the palate, right? So there are few different methods to hold the tongue while doing lingual phenectomy. First method, if the patient is cooperative, then you can go for suture bite and you can hold the tongue with the help of that. Second thing, you can use an ice cream stick with V-shaped notch and you can hold the frenum in between that. And in uncooperative patients, ultimately you need to use the bite block and you have to perform the lingual phenectomy. Okay, let's see gingival depigmentation. What magic can be done with the help of lasers? Melanin hyperpigmentation usually does not present a medical problem, but patient may complain their black gums are unesthetic. This problem is more aggravated in patients with a gummy smile and excessive gingival display. Now let's see, these are the few methods to perform the depigmentation procedure. The method include the scalpel surgical technique, slicing or partial thickness flap technique, then bone denudation, then burr abrasion technique, scraping, gingectomy, electrosurgery, lasers, and free gingival graft. So we have performed the depigmentation with the help of lasers. This is a pre-operative photograph where we can see heavily pigmented gingiva is present, and in this post-operative photograph we can see a beautiful big gingiva is formed post-operatively. Now setting used for this is 940 nanometer, power 0.5 watt, and pulse mode has to be used. Make sure that you should check the thickness of the gingiva before you perform the depigmentation procedure, or else you will end up into perforation of the gingiva. Now let's see lasers in endodontics. Root canal disinfection. Basically, root canal disinfection can be performed with the help of different dyes. You can use endocyanin green dye, methylene blue dye, then you can use hypochlorite also. First, you have to open up the axis, then conventional instrumentation or BMP has to be done. Then after that, you irradiate the lesion with the help of lasers. Okay, let's see a video of this case. Laser bleaching. Now, this is my favorite topic. I usually talk for hours on these topics. Due to short period of time, we are going to discuss few cases and basics of laser bleaching. If your patient knew about the whitening and could afford it, how many of them do you think would like to have a whiter teeth? Nowadays, ladies spend lot of money and hours in beauty parlors to look beautiful, right? Even men's are not behind. They have their specific salons, Beardo and all, and they spend lot of time and lot of money to shape up their beard and all, right? We have, but do you think they spend the money on the beauty parlors? But do you think they will spend the money for teeth bleaching? I don't think so. Even I haven't seen a patient specifically claiming that I have to go for bleaching. You have to motivate the patient and you can get it converted, right? Now, these are the different causes of discoloration of tooth. Tea, coffee, smoking, stainy foods, then gutka chewing, bolo zuba kesri, then wine and strawberry and some stainy foods. These are different causes of discoloration, but which cannot be treated with the help of bleaching. Okay, so fluorescence stain, tobacco smoking, trauma, tetracycline stain, caries, and amalgam stains are there. Okay, so for each one of these, you need a specific approach. For example, discolored tooth or caries are there. You need to go for restoration or RCT as per requirement. Tobacco staining and all, you can go for scaling and then fluoresces, ultimately you need to cover up them with veneers if required. Bleaching can be done, but up to some extent. Okay. Now, diode laser light as a bleaching light. The action is to stimulate the catalyst in the chemical. There is less dehydration of the enamel. And diode light is ultra fast. It takes only 3 to 5 seconds to activate the bleaching agent. Okay, so you don't need to hold that your light curing unit for hours and hours for the activation of bleaching agent. Okay, this is a pre-operative photograph and post-operative photograph of a bleaching case where we can see a darker shade pre-operatively and a lighter shade post-operatively. Now the power used for this is 4 watt in continuous mode. Okay, wavelength I have used over here is 810 nanometer. Okay, let's see. Now let's see a case of bleaching one by one, like step by step. Sorry. So this is a pre-operative photograph of the patient. Then we have performed the scaling and root planing, and after that we have applied the gingival barrier. I have used Optradam over here for the isolation. Then the bleaching agent is applied and irradiated with the help of lasers. Okay. This is a pre-operative photograph, and we can see a beautiful post-operative photograph with a lighter shade. Okay. So let's see next case of second stage surgery, which can be performed with the help of lasers. This is a pre-operative photograph and post-operative photograph after using the laser. This is okay for a single implant or a single or dual implant. But what about multiple implants? In multiple implants, you have to expose full arch, right? And exposing a full arch, reflecting a full flap will lead to the bone loss. So in such cases, laser is a good option to perform the second stage surgery. This is a pre-operative photograph, and this is a immediate post-operative photograph with no reflection of flap. Let's see a video of the second stage implant surgery. You can see the crown cover screw is exposed now. Now, the treatment of aphthous ulcer can be done with the help of lasers. Now, this ulcer is almost sizing 12 to 15 millimeter in diameter. Now, such ulcer takes lot of time to heal on its own or with the help of medication. But with the help of lasers, you can reduce the pain of the patient and you can faster the healing of the ulcer. So this is a pre-operative photograph. This is an immediate post-operative photograph after single setting of lasers. You can see those are small red spot. Those are neogranulation tissue. So healing is started. So this is a 3-day photograph of the same patient, and this is a 7-day photograph of the same patient with absolute total healing of the ulcers. Let's see a video for this case. Here we have used 660 nanometer laser. Now let's see some more uses of lasers. We can use it for removal of skin tag, then mole removal and skin tag and wart removal also. So this is a pre-operative photograph where we can see a wart in the scalp, and this is an immediate post-operative photograph where we have removed the scalp wart within 2 minutes. Let's see another case of wart which was present on very delicate space. It was present on the upper eyelid. Okay, so we have removed it with the help of lasers. This is a immediate post-operative photograph with zero bleeding, and this is a follow-up photograph where we can see a good healing. Okay. So let's see a case of biopsy, few cases of biopsy. Now, this is the definition of biopsy: removal of tissue from living being for macroscopic examination, microscopic analysis, bacterial analysis, and combination of above this is called as biopsy. Now, let's see a case of peripheral giant cell granuloma excision. This is a pre-operative photograph, and we can see the size of the lesion is 17 millimeter. This is an immediate post-operative photograph, and we can see a beautiful healing after the excision. This is another case of peripheral giant cell granuloma removal. It is present in one region. This is a pre-operative photograph, and this is an immediate post-operative photograph with no or zero bleeding, we can see. Okay, so this is an excised tissue. Now, this patient has approached to us for the balloon which was present on the lower lip as told by the patient. On close observation, we have found that it is a mucocele. So this is a pre-operative photograph of the same case, and we have done the excision with the help of lasers. So this is a post-operative photograph with absolutely no or zero bleeding, we can say. And the photograph, even see his happy face. Pre-operatively he was slight nervous about it, and post-operatively he is happy. Okay. Now let's see a case of incisional biopsy. This is a typical traumatic ulcer on the tongue which was present since 6 months. The patient didn't went to a dentist or any doctor. They approaches to us for this diagnosis of non-healing ulcer. We went for an biopsy, and ultimately it came out as a carcinoma of tongue. Let's see a video of this case. With lasers, as such, there is no bleeding, but as tongue is very vascular structure, we have faced slight amount of bleeding because of rupture of some capillary. This is a post-operative photograph, immediate post-operative photograph. This was turned out as a carcinoma of tongue. Okay. Now let's see another case of traumatic ulcer. This patient came to us for the ulceration with 1/8 region. Now, after having a close observation, we have found that the ulcer is non-healing and traumatic ulcer. Before proceeding to extraction, we went for a biopsy, and we found that the lesion is carcinoma, squamous cell carcinoma, and that too well differentiated carcinoma. This is a pre-operative photograph, and this is a immediate post-operative photograph after biopsy. And we can see in the biopsy report, we can see it as a squamous cell carcinoma, and that is well differentiated. Okay. Now, if you are an Instagrammer, you must be knowing this creature, Khabi. Let's see how to start your laser practice. Now, many practitioners have different excuses for not using lasers. Let's see what excuses they give. First thing, it is too expensive. यार इतना पैसा कौन खर्चे करेगा, मिलेगा क्या, वापस मिलेगा उतना, ऐसा सोचते हैं. But trust me guys, if you are using it properly, if you market it properly, there is good ROI for lasers. Okay. Then learning curve is too steep. यार वो सीखने के लिए बहुत difficult है, वो कैसे करेंगे, कैसा ट्रेनिंग कैसे मिलेगा. Trust me guys, it is not a rocket science. You can learn lasers easily. Safety precautions, if you take all safety precautions, it is absolutely safe and not better than traditional method. Like people, those who are oral surgeon over here, they will say यार वो blade 1 मिनट में काम कर देता है, ये laser से कौन खेलते बैठेगा, right? But there are few advantages of lasers over scalpel, so you can use lasers, and ultimately it's a mind game. If you can see this photograph on the right, they are too busy for the improvement and they want to go with the conventional method only. But trust me guys, if you improve yourself, it will be easier task for you to go ahead in dentistry. Okay, now let's see how many lasers are available in the Indian market and which one to buy. Now we have Pion Laser, Novalace, Biolace, Sirona, then Zolar, IMDSL, DPI, Indilace. There are many laser companies and they and their salesperson will claim that our laser is best. But ultimately, if you want to buy laser, you have to do your self-assessment. Now let's see how to do a self-assessment. First, assess your needs. What all procedure you are going to perform with the help of lasers, which wavelength you want to buy. Like 810 nanometer wavelength is more versatile wavelength than any other wavelength, so 810 will be a better option. Power, almost all the oral surgical procedures can be performed with 4-watt lasers only. The company person will claim that higher the power, higher the cutting efficiency, but don't trust them guys. They are the salesperson, right? They want to sell. Okay, so all the surgical procedure, intraoral surgical procedure which we perform can be done with the 4-watt laser also. Then attachment, you should ask the dealer what all attachment they are going to provide along with the lasers. It should be user friendly. The most important thing is service and support. If that XYZ person is giving a proper servicing and support, then that laser is good. Okay, and additional cost required for the consumable. Make sure that you should ask for additional consumable cost, because few lasers have disposable tip system. Those disposable tips are costing around 400 to 500 rupees, around 400 to 500 rupees. In for each and every patient, if you are using, ultimately you need to charge more for such cases, right? Now, choice of laser will be depending upon the specialty also. If you are an oral surgeon, they need to cut majority part जो होता है वो काट छाट वाला होता है यार, तो they need a higher power laser. Okay. For orthodontists, they use maximum for the Phenectomy procedure, fibrotomy procedure, then canine exposure procedure. In such cases, soft tissue lasers can be used effectively. In pediatric dentistry, most of the procedure can be performed with the hard tissue lasers. Even cavity preparation and all the things can be performed with the help of hard tissue lasers. And you know those winning voice of aerator that can be avoided with the help of lasers. Okay. For a periodontist, most of the procedures are soft tissue procedures, so diode laser is best for a periodontist. Now, how to set up a laser operatory? See, the laser which is present on screen on the left is a hard tissue laser, and the one on the right side is a soft tissue laser. So if you are buying a hard tissue laser, make sure that you should have a separate operatory. Second thing, it should have a water and air inlet for it. Okay. For soft tissue lasers, you don't need any settings. You can easily carry out in any operatory. Okay. But for hard tissue laser, you need to have a separate operatory, as it cannot be shifted to one operatory to other operatory. Okay. Now, it is very important that all your clinic staff should be trained for the procedure that can be performed with the help of lasers, the finances that you need to charge more for the laser, and the assistant should be trained to handle the laser. Imagine the laser, वो assistant उठा के लेके जा रही है लेजर और हाथ से गिरा दिया, वो assistant का तो जाने दो, लेकिन डॉक्टर को हार्ट अटैक जरूर आएगा. So make sure all your clinic staff has to be properly trained. Okay. Now have a close look at this picture and tell me what is the difference. Yes, the red flower is different from other yellow flowers, right? So this red flower is the dentist who is practicing with the help of lasers. Not only lasers, but any specialty practice. For example, any endodontist will have a microscope or something, or any prosthodontist will have a scanner or something. So this is a red flower. This red flower is a specialty practice, and those other are the competitor dentists. So if you want to be different, then you should have something different than others. Okay. So USP, it is a unique selling proposition. If you have laser, you can develop your USP as a laser therapist. You can tell the advantages that there will be less need of antibiotic and analgesic, easier healing, less bleeding, less post-operative discomfort, and less chair side time. So, and as I told you, now the patients are Google and YouTuber patients. They will search everything on Google and then they will come to you. So this can be a USP for you all. So let's come to the conclusion. Let's come to the conclusion. For conclusion, for take home message, I don't have any message as such, but I have a video for you. Please have a close look at this video, and I hope you'll understand the importance of upgradation in your practice. In today's world, everything is replaced with the help of technology, telephone to cell phone, TVs to LED screens, radio to iPods, letters to emails. But did you ever imagine this? Now listen carefully.
क्या है भैया? नहीं है, छुट्टा नहीं है।
मैं छुट्टा देऊंगा माँ, भूख लगा है क्या तो खाऊंगा माँ।
ओफो,
माँ
भैया छुट्टा नहीं है।
जो मैं देऊंगा छुट्टा देऊंगा माँ।
नहीं है, कार्ड है मेरे पास।
कार्ड
छुट्टा
है तो
नहीं है।
कार्ड लाओ तो मेरे पर मशीन है, सेव कर लो।
दिखाओ कार्ड मशीन।
हाँ दिखाता हूँ।
कार्ड का मशीन है।
अरे इसके पास मशीन है।
अरे इसके पास कार्ड मशीन है।
So the point is, if he don't have that swapping machine, he must have lost his income, right? In the same way, you're missing or you're losing your income if you don't have the technology. So upgrade is necessary, right? So this was a take home message from me to you all. We do conduct laser courses across India, in which we have a proper full day workshop on laser dentistry. We cover from basics to advanced of lasers in this one session, along with the hands-on on tomato, chicken piece and goat jaw and many other things. If you want to learn more about lasers, you can contact me on this number. We have our next batch, upcoming batch in May 2020 at Aurangabad, Maharashtra. This is my contact number and my clinic address where I practice in Aurangabad. You can have a screenshot of this. If you want to contact me, you can contact anytime. And thank you. Thank you. If you have any questions, you can open up your mic and video and you can